Welcome to This Explainer. If you've ever stared at a hospital bill and thought to yourself, how on earth do they come up with these numbers behind the scenes? Well, you are absolutely in the right place. Today, we're unpacking exactly how the medical equipment and supplies industry navigates this really intense pressure to keep costs down while simultaneously uncovering massive revenue opportunities. We're going to dive straight into the actual industry standards used to measure affordability, pricing, and market share, and we'll distill all those incredibly complex financial metrics into a clear, understandable picture.
All right, let's take a quick look at our roadmap for today. We've got 1. The healthcare pricing pressure. 2. Expanding access, capturing revenue. 3. Measuring pricing transparency. 4. List price versus net price. And 5. Why fair pricing matters. Section 1. The healthcare pricing pressure, or as I like to call it, the macro pressure cooker. So on the surface, the medical equipment industry has these incredibly powerful built-in growth engines, right? We've got an aging population, diseases tied to lifestyle. It all creates a naturally expanding market. But there's a massive ceiling being built overhead. Listen to this exact wording straight from the SASB Sustainability Accounting Standards. Regulatory emphasis on reduced costs in all markets may result in downward pricing pressure. This isn't just a localized one-off issue. It is a global reality. As healthcare costs skyrocket, regulators everywhere are actively pushing back, literally squeezing the profit margins of the companies making these vital supplies. And when you look at the specific market forces, they act like a literal pressure cooker, demanding lower costs. First, you have the extension of government insurance programs. When the government is your buyer, they're a massive buyer, which means they can demand far steeper discounts. At the same time, healthcare providers and payers are consolidating. Hospitals are merging into these giant networks, giving them unprecedented negotiating power. Add in specific regulatory initiatives aimed directly at cost containment, and boom, you've got a perfect storm continuously driving prices down. Moving right along to Section 2, Expanding Access, Capturing Revenue, the Fair Pricing Pivot. Now here is the plot twist, and honestly, it's a fascinating one. The really smart companies don't just fight this pressure. They lean right into it. Think of it like a giant balancing act on a scale. On one side, yes, you have the risks of cost containment. You're making less money on every single unit you sell. But on the flip side, you have massive revenue opportunities through expanded access. The standard explicitly points out that companies ensuring fair pricing can actually neutralize that downward pressure. By balancing cost containment with better access to care, they can capture entirely new market share among populations that might normally avoid seeking healthcare. So lower margins per unit, that can absolutely be offset by a massive increase in volume. Which brings us to Section 3, Measuring Pricing Transparency, how companies disclose prices. Because it's one thing to claim you have fair pricing, right? But how do investors actually measure and verify that? Well, looking at the standardized industry reporting framework, specifically under the affordability and pricing category, we're going to focus on metric HCMS 240A.2. This is the exact data point companies use to shed light on their real-world pricing practices. This specific metric requires companies to describe exactly how price information for each product is disclosed to customers. It basically forces them to put their transparency practices on the public record. They have to explain the nature, the scope, and the implementation of their pricing. Like, are they giving buyers the absolute range, the median price, or just the typical average price? But as you can probably guess, transparency in healthcare is rarely simple. It's definitely not as easy as checking a price tag on a grocery store shelf. Companies have to navigate a super tangled web of intermediaries. Customers usually don't buy directly. They go through group purchasing organizations or GPOs, and they use consultants to negotiate for them. And to make it even more restrictive, there are frequently strict confidentiality clauses in these purchasing agreements. So the hospital buying the MRI machine, they're legally barred from telling any third party what they actually paid for it. And the complexity just keeps going. The standard also asks companies to discuss the operational factors that inherently change how a device is priced. And this makes sense. Pricing fluctuates based on the volume a customer buys, their geographic region, and even the type of facility they operate. For instance, a massive urban research hospital is naturally going to get a wildly different price structure than a tiny rural clinic. Section 4. List price versus net price, the weeds of wholesale acquisition. Now we have to get into the financial weeds of how price changes are actually tracked year over year. To really grasp affordability, you've got to track inflation over time across a company's entire global portfolio. Going back to our framework, the next metric is 248.3. This one mandates the disclosure of the annualized percentage change in both the list price and the net price. So what is the actual difference between those two? Let's break it down. First, the list price. The standard dictates this should be calculated using the wholesale acquisition cost, or WAC. You can just think of the WAC as the sticker price. It's the baseline starting point, the revenue-weighted average cost before any negotiations or backdoor deals happen. The net price, on the other hand, reveals what is actually paid. To get this number, you take that baseline sticker price, the WAC, and you subtract all the rebates, all the discounts, and any returns for that period. This is the real bottom-line money changing hands. And this side-by-side comparison is brilliant because it illustrates exactly why tracking the gap between these two figures is so vital for investors. Think about it. If a company's list price jumps, say, 10%, but their net price only creeps up 2%, well, that tells you they are throwing out massive rebates and discounts behind the scenes just to keep their sales volume up. It totally exposes the reality of that downward pricing pressure we talked about at the very beginning. Of course, to make these numbers actually useful, companies don't just dump raw data on you. They provide context. They might break the data down by region or product type to show local trends. They explain their strategy for determining those prices. And crucially, they can provide comparative inflation data. They tie their price changes to broader consumer price inflation to show if their products are actually getting more or less expensive in the real-world economy. Section 5. Why fair pricing matters. The big picture takeaway. So, stepping back from all the metrics and accounting definitions for a second, if you're looking at a medical device company's long-term viability, why do these complex affordability metrics actually matter? It's because successfully balancing cost containment with expanded access is not just good PR, it fundamentally secures and grows your market share. In an industry where government buyers and consolidated hospitals are ruthlessly demanding lower prices, the company that masters fair, transparent pricing can tap into vast new populations. They trade those high margins for high volume, creating a much more robust, sustainable revenue stream, and they genuinely improve global health outcomes while doing it. As we see these downward pricing pressures continue to mount globally across the healthcare sector, it really leaves us to wonder. As the old traditional models of hidden markups fade away, is transparent, fair pricing no longer just some regulatory hoop to jump through, but actually the ultimate competitive advantage for the future of global healthcare? Something to think about. Thank you so much for joining me for this explainer. Keep questioning, keep learning, and I will see you next time.